Your body warns. 10 signs of cancer. Do not ignore.
Doctors are sounding the alarm. These 10 seemingly harmless body changes that millions dismiss every day could actually be your body screaming for help, warning you of cancer developing right now. The most terrifying part? These symptoms hide in plain sight, disguised as everyday annoyances you've been taught to ignore. You probably blame them on stress, aging, or being too busy. But that's exactly why 40% of cancers are caught too late. This video will reveal the 10 most overlooked cancer warning signs that doctors desperately wish their patients would recognize sooner. Most people ignore every single one until it's too late. By the end of this video, you'll know exactly what your body is trying to tell you and what could save your life. According to a 2024 comprehensive review covering nearly 1 million patients, these symptoms are your body's early warning system, alarm bells that something is seriously wrong. The American Society of Clinical Oncology confirms that recognizing these signs leads to earlier diagnosis in 73% of cases. Here's what should terrify you. Ignoring these symptoms for just 6 months can mean the difference between stage 1 cancer with a 90% survival rate and stage 4 with less than 20%. Pay extremely close attention to every single sign I'm about to reveal, especially number 7, the one that 84% of cancer patients reported having but never mentioned to their doctor because they thought it was normal.
This video is for educational purposes only and not a substitute for professional medical advice. Always consult a qualified healthcare provider about your health. All information shared is backed by credible, peer-reviewed research with links to the original studies in the description.
Let's get started with sign number 1, unexplained weight loss. You might think losing weight without trying is a blessing, but doctors call it one of the most sinister cancer symptoms. We're not talking about dropping a few pounds from stress or a busy week. This is losing 5% or more of your body weight over 6 to 12 months without any changes to your diet or exercise routine. This isn't your metabolism finally kicking in, it's potentially cancer cells hijacking your body's energy systems. A massive 2024 study analyzing 25 research papers and nearly 1 million patients found that unexplained weight loss has the strongest links to pancreatic, gastroesophageal, and lymphomas. Your body is literally being consumed from the inside as cancer cells multiply exponentially, stealing nutrients meant for healthy tissue. Research published in the BMJ followed 326,240 adults reporting unexplained weight loss to their primary care doctors. The terrifying result? Within 6 months, 4.8% received a cancer diagnosis. That's nearly 1 in 20 people. When combined with other symptoms like anemia or elevated inflammatory markers, the risk skyrocketed even higher. Pancreatic cancer patients in particular reported weight loss as their very first symptom, months before any pain appeared. Here's your immediate action. If you've lost 10 pounds or more in the last 3 months without trying, document it immediately. Weigh yourself right now, write it down, and if the loss continues for another 2 weeks, demand, don't ask, demand comprehensive blood work, including CBC, metabolic panel, and tumor markers. The moment your clothes feel loose without explanation, that's your body's warning shot. Don't celebrate it, investigate it.
Sign number 2 is persistent, unexplained fatigue. This isn't the normal tiredness you feel after a long day or a poor night's sleep. This is different. This is a profound, soul-crushing exhaustion that sleep doesn't touch. Cancer-related fatigue feels like someone pulled your plug from the wall and no amount of charging brings you back to full power. What's actually happening inside your body is a metabolic war. Cancer cells are multiplying at an astronomical rate, consuming glucose and oxygen meant for normal cells, while simultaneously releasing inflammatory cytokines that poison your energy production systems. Studies show this fatigue can persist for years even after successful treatment, permanently altering your mitochondrial function, the powerhouses of your cells. The American Society of Clinical Oncology reports that up to 99% of cancer patients experience this crushing fatigue. But here's the shocking part. 84% said it was their most distressing symptom, yet only a minority ever reported it to their doctors before diagnosis. Multiple studies confirm that cancer-related fatigue often appears months or even years before other symptoms, making it potentially the earliest warning sign. Researchers using advanced electroencephalography and actigraphy have now proven this isn't psychological. It shows up as measurable changes in brain waves and movement patterns. Pay attention to the type of fatigue you're experiencing. Ask yourself, is this a bone-deep exhaustion that a full night's sleep or a relaxing weekend doesn't fix? To get a clearer picture, track your exhaustion on a 1 to 10 scale every day for 2 weeks. If your number consistently stays at a 7 or higher, despite adequate rest, your body is signaling a deeper issue. It's time to schedule an appointment with your doctor for comprehensive blood work. Be sure to discuss testing your ferritin, B12, thyroid, and inflammatory markers.
Sign number 3, drenching night sweats. Waking up with damp sheets from a nightmare is normal. Waking up in a puddle of sweat that soaks through your pajamas, sheets, and mattress when your room is cool, that's your body's thermal regulation system going haywire, often from cancer. These aren't hot flashes or anxiety sweats. In medical terms, these are called drenching night sweats, and they're part of what oncologists call B symptoms, the trilogy of terror that includes fever, weight loss, and night sweats. Your hypothalamus, the body's thermostat, is being bombarded by inflammatory signals from cancer cells, particularly in lymphomas and leukemias. The cancer is literally cooking you from the inside out. Hard data shows that 25% of Hodgkin lymphoma patients and up to 33% of aggressive non-Hodgkin lymphoma patients report severe night sweats at diagnosis. Patient forums like My Lymphoma Team are filled with survivors saying night sweats were their first and most persistent symptom, often accompanied by unexplained itching. But it's not just blood cancers. Breast, prostate, and lung cancers can all trigger this symptom through hormonal disruption or direct hypothalamic involvement. The red flag is the severity. If you are waking up in the middle of the night and your sleepwear or sheets are damp or outright soaked, and this happens repeatedly, regardless of the room temperature or the number of blankets you're using, that is a drenching night sweat. This is not normal. Do not dismiss it as hormonal changes or anxiety without first ruling out something more serious. Sign number 4, iron deficiency anemia. Your doctor might casually mention you're a bit anemic and prescribe iron supplements, but unexplained iron deficiency anemia, especially in men or postmenopausal women, is a blazing red flag for internal bleeding from cancer. Here's what's really happening. Cancer in your digestive tract, colorectal, gastric, or esophageal, causes microscopic bleeding that's invisible to the naked eye. You're literally bleeding out slowly, drop by drop, while the cancer grows. Studies show up to 50% of colorectal cancer patients have iron deficiency before diagnosis. But it gets worse. The iron deficiency itself may fuel cancer growth by impairing your immune system's ability to detect and destroy abnormal cells, creating a vicious cycle of depletion and disease. Recent research is terrifying. Iron deficiency anemia in colorectal cancer patients correlates with more aggressive tumors, worse treatment responses, higher surgical complications, and significantly reduced survival rates. The prevalence reaches 60% in advanced cases, and post-treatment rates are even higher. Multiple studies confirm that iron deficiency may actually be tumorigenic, meaning it doesn't just indicate cancer, it might help cause it by destabilizing your genome and promoting hypoxia-driven cancer pathways. Know these numbers. Hemoglobin below 12 grams per deciliter for women or 13.5 grams per deciliter for men. Ferritin below 30 nanograms per milliliter or transferrin saturation below 20% demands investigation, not just supplementation. If you're experiencing fatigue, pale skin, frequent infections, strange cravings for ice or dirt called pica, brittle nails, or a sore tongue,
These aren't just signs you need more spinach. Demand a colonoscopy and upper endoscopy immediately. The bleeding source must be found. Every day of delay allows potential tumors to grow larger and spread deeper.
Sign number 5, chronic cough and hoarseness. That cough that won't quit after 3 weeks? That raspy voice that makes you sound like you've been smoking for decades when you haven't? These aren't just annoying. They're potentially deadly warning signs of lung, throat, or thyroid cancer. A persistent cough means something in your respiratory system is constantly irritated, often by a growing tumor. Hoarseness occurs when cancers in the larynx, pharynx, thyroid, or esophagus physically press on or invade the nerves controlling your vocal cords. Your voice box is literally being strangled by cancer. What's terrifying? A comprehensive review published in the journal Thorax highlighted that 65 to 80% of lung cancer patients experience a chronic cough, with the prevalence nearing 90% in advanced stages. Yet most dismiss it for months as allergies or a lingering cold. Comprehensive reviews show laryngeal carcinoma is a major cause of persistent hoarseness in adults, while esophageal and thyroid cancers present similarly when tumors infiltrate surrounding tissues. The tragedy? Referral rates for persistent cough or hoarseness are dangerously low, especially in non-smokers or younger adults who don't fit the typical cancer profile. Studies show the average delay between symptom onset and diagnosis is 3 to 6 months, time during which early-stage treatable cancers become advanced, incurable diseases. Any cough lasting more than 3 weeks requires investigation. Any hoarseness lasting more than 2 weeks demands examination. Document everything. Is your cough dry or productive? Is there blood, even pink-tinged? Does your voice completely disappear or just sound rough? Record yourself speaking and coughing weekly. Changes you don't notice day to day become obvious when compared. Demand a chest x-ray, laryngoscopy, and if you've ever smoked, even socially, a low-dose CT scan. Lung cancer killed more people last year than breast, colon, and prostate cancers combined. Don't become a statistic. Sign number 6. Difficulty swallowing. That feeling like food gets stuck, like you need extra water to wash things down, like your throat has narrowed. This isn't aging or acid reflux. Progressive difficulty swallowing is a cardinal sign of esophageal cancer and other serious malignancies. Dysphagia happens when tumors physically obstruct your esophagus or infiltrate the muscles controlling swallowing. It typically starts with difficulty swallowing solids. Bread feels like cardboard, meat like rubber, then progresses to soft foods, and eventually even liquids become challenging. By the time most people seek help, the tumor has often grown large enough to block more than half the esophageal diameter. You're literally being strangled from the inside. Clinical data reveals that 74 to 83% of esophageal cancer patients present with progressive dysphagia as their primary symptom. Survey-based research shows a cruel irony. Dysphagia finally drives patients to seek help, but by then most have advanced disease. Studies indicate that up to 40% of head and neck cancer survivors continue experiencing dysphagia after treatment, permanently compromising nutrition and quality of life. The window between occasional difficulty and can't swallow can be devastatingly short, sometimes just weeks. Do you avoid certain foods because they're hard to swallow? Do you cut food into tiny pieces? Have you switched to mainly soups and smoothies? Do you feel like food sits in your chest? Any sensation of food sticking, even occasionally, requires investigation. If you're losing weight because eating is difficult, if you're coughing or choking during meals, if you have persistent heartburn with swallowing problems, these aren't signs to pop antacids. Demand an immediate endoscopy and barium swallow study. Esophageal cancer has a 5-year survival rate of only 20% when caught late, but up to 45% when caught early.
Sign number 7. Persistent bloating and pelvic discomfort. This is the big one, the one that gets dismissed the most. That constant uncomfortable swollen feeling in your abdomen that doesn't go away.
coupled with a dull ache or pressure in your pelvis. If it lasts for more than 3 weeks and is a new change for you, it is not IBS or menopause. It is the #1 warning sign for ovarian cancer, the silent killer. The bloating from ovarian cancer isn't gas. It's often a sinister buildup of fluid in the abdominal cavity called ascites. Cancer cells on the surface of the ovary irritate the lining of the abdomen, causing it to leak fluid. This fluid is filled with cancer cells, which then spread throughout your entire abdominal cavity like toxic seeds in poisoned soil. Your belly is literally inflating with a cancerous fluid while the primary tumor presses on your bladder and bowel. Major cancer organizations, including Ovarian Cancer Action and studies published in gynecologic oncology journals, report that persistent bloating is the most common symptom leading to ovarian cancer diagnosis. Research shows women with new-onset, frequent, persistent bloating had significantly elevated cancer risk. The tragedy? Most cases are misattributed to irritable bowel syndrome, menopause, or normal aging. By the time visible abdominal distension occurs, the disease has often spread beyond the ovaries. Research shows 84% of ovarian cancer patients reported having this symptom but didn't recognize it as dangerous. Get a tape measure. Starting today, measure your waist at the belly button every morning for 2 weeks. An increase of 2 inches or more that doesn't go away is a massive red flag. Use the rule of 3. If you have bloating that occurs more than 3 times a week, lasts for more than 3 weeks, and is accompanied by at least one other symptom, pelvic pain, urinary urgency, or feeling full quickly, you must act. Insist on 2 specific tests, a CA-125 blood test and a transvaginal ultrasound. Ovarian cancer is only silent if we are silent about its symptoms.
Sign number 8, new onset back or bone pain. Deep, aching pain in your back or bones that started recently, gets worse at night, and doesn't improve with rest or typical pain relievers. This isn't aging or poor posture. It could be cancer that's either originating in or spreading to your bones. Cancer bone pain has a sinister quality. It's often worse at night because when you're lying down, blood flow changes increase pressure on affected areas. Pancreatic cancer causes distinctive mid-back pain as tumors press against nerves. Metastatic cancer from breast, prostate, lung, or kidney creates hot spots in bones where cancer cells set up secondary tumors, literally eating away at your skeletal structure from within. The bones aren't just aching, they're being dissolved by cancer. Data from oncology clinics is clear. Pain is reported as an early symptom in 60 to 84% of patients with advanced cancers involving bones. For pancreatic cancer, that dull back pain is a classic early sign. And for prostate cancer, the statistics are horrifying. A study in the Journal of Clinical Oncology noted that up to 89% of some cohorts present with bone metastases and pain at the time of their initial diagnosis. Does your pain wake you from sleep? Is it getting progressively worse despite rest? Does it feel different from muscle soreness, deeper, more constant? Does weight bearing make it worse? If you answered yes to any of these, especially if you're over 50 or have a history of any cancer, stop accepting it's just arthritis. Demand imaging. X-rays miss 30 to 50% of bone metastases, so insist on MRI or bone scan if pain persists. Bone metastases found before fracture can be treated. Those found after fracture often signal the beginning of the end.
Number 9, persistent itching without rash. This is one of the strangest and most missed signs, a maddening, relentless itch, pruritus, that has no apparent cause. There's no rash, no bug bites, no dry skin. It's an itch so deep and persistent that it can wake you from sleep and make you scratch until you bleed, and no amount of lotion or antihistamines helps. This isn't an allergy. Cancer-related pruritus occurs when tumors, especially blood cancers like Hodgkin lymphoma or polycythemia vera, release a flood of histamines and other inflammatory chemicals into your bloodstream.
In other cases, liver, bile duct, or pancreatic cancers can block the flow of bile, causing bile salts to build up in your skin, leading to an unbearable itch. Your skin is literally reacting to a toxic internal environment created by the cancer. This is a well-documented paraneoplastic syndrome. Studies show that 10 to 25% of patients with Hodgkin lymphoma report severe pruritus. It's even higher in polycythemia vera, affecting up to 50% of patients. A large Danish registry published in the Journal of the American Academy of Dermatology found that people with chronic, unexplained itch had a significantly higher than expected incidence of both hematologic and solid tumors. A particularly telling sign is aquagenic pruritus, an intense itching specifically triggered by contact with water, which is a classic symptom of myeloproliferative neoplasms. If over-the-counter remedies provide zero relief after 2 weeks, and if the itching persists for more than 6 weeks, you must investigate. Demand a complete blood count with differential, comprehensive liver function tests, and an LDH level. Sign number 10, neurological changes, headaches, and brain fog. Those persistent headaches that feel different from any you've had before, that mental fog making you forget words, miss appointments, or feel like you're thinking through mud. These aren't just stress or aging. They could signal brain tumors, metastases, or paraneoplastic syndromes where cancer elsewhere triggers brain inflammation. Cancer headaches have distinct characteristics. They're often worse in the morning due to increased intracranial pressure from lying flat, accompanied by nausea or vomiting, and progressively worsen despite medication. The cognitive changes, difficulty concentrating, personality shifts, memory lapses, occur when tumors disrupt neural pathways, or when cancer elsewhere produces antibodies, anti-HU, anti-YO, anti-RI, that attack brain tissue. Your brain is literally under attack, either directly from tumors or indirectly from cancer's biochemical warfare. Multiple series published in journals like Neurology show that up to 71% of brain tumor patients report headaches as a presenting symptom. Furthermore, research on what's often called chemobrain has found that cognitive impairment affects 30 to 75% of cancer patients, and crucially, these symptoms can even precede a diagnosis. These paraneoplastic neurological syndromes can cause a rapid, devastating neurological decline months before the primary tumor is ever found. Track these specific warnings. Any new persistent headache that is worse in the morning, any headache associated with neurological symptoms like blurred vision, weakness, or numbness, and for cognitive changes, are you having trouble finding words? If you experience a thunderclap headache, sudden severe, any seizure, progressive weakness, or personality changes that others comment on, this is an emergency. Demand MRI with contrast, not just CT scan. CT misses 20 to 30% of brain tumors. Early brain tumors are treatable. Late ones are often terminal.
Thanks so much for watching. If you found this video helpful, please give it a like, and don't forget to subscribe for more science-backed health insights. Your support really helps us bring you more valuable content.